Assalamu alaikum. Hello friends. This is Dr. Bashir Hassan from Ireland. After a bit of gap, I'm back and today I'll talk briefly on MRCP Ireland exam pattern and resources for preparation. During the last few days, few weeks I would say, I've been asked few questions by different colleagues here which came from Pakistan recently and few friends back in Pakistan as well. Though I have posted a detailed video on MRCP Ireland earlier on my channel, maybe some people are not watching and going through that in detail. I'll briefly try to summarize it, what I have seen. So if I go through MRCP Ireland part 1, I'll just talk on two things today. The first one is the exam pattern and the second one would be the question bank to which the exam I have found is very much similar, and I would recommend that question bank. So the first thing, coming on to the exam pattern, MRCP Ireland consists of a single paper of 100 multiple choice based questions, which I would say, I must say, is easier if I compare it with MRCP UK, which has two papers. So it has just one paper, 100 multiple choice based questions. You have to do that in 3 hours time. That's 180 minutes. So it's pretty much doable. In terms of time management as well, it's easier than MRCP UK. So 100 questions in 3 hours time, right? Now if I split the paper, I must say most of the paper is clinical. Around 70% I have found are simple clinical scenarios from common diseases, I would say, like pneumonia, stroke, MI, asthma, COPD, few images there. So I would say more than 70% I have found is clinical. I am mentioning this because most of the people appearing in exam are just so much worried about the basic part. They say that part 1 has a lot of basics. It has basics, but it is not more than 20-30%. And if you can get half of that and you do the clinical part good, you will get through the exam. So most of it is clinical, more than 70%. It has basics, it has statistics, it has few other things, but it is 20-30%, not more than that. Okay, just 5-6, less than 10 I would say at maximum. Images, maybe a chest X-ray or two, an ECG or two, and one or two other spot diagnoses. So but most of the questions are clinical and rather, I would say, simple scenarios from common diseases. So you need not to just go through big books and all that. I would not recommend. And definitely, even if you study a lot, in the end it depends on your luck, I would say, what you get on the day of examination, really. You can get a really hard paper, you can get a really easy paper. So luck matters as well. So this was the exam pattern. 100 questions, mostly clinical, some basics, and the scenarios are not too long. They are brief, mostly just around 10%, 10 to 20% are a bit long questions. and time management is very much easy. Second thing is, as I told you, I'll talk on the question bank, to which the exam is, I would say, I have found pretty much similar. I have seen people preparing from past medicine, doing past tests, a lot of things. But what I have found in paper is the exam is more similar and is on the pattern of BMJ on examination question bank. I must say, exam is pretty similar to BMJ on exam, and I would highly recommend doing BMJ on exam question bank twice before the exam. If you have bit of basics, bit of clinical in your head, you just need to go through BMJ on exam question bank twice in 2 months time before the exam, and I'm very confident you will get through. Yeah, if you haven't been through basics and your clinical side is also a bit weak, then you can just first study using past medicine or past test. But again, I would recommend do BMJ on examination twice before the exam, and I'm really confident about this, that you will get through the exam. And the third thing, which is the good news, is the passing percentage in part 1 is not too high. It's just 50% mostly. So you just need to do it 50% and you are done with that. So this was briefly MRCP Ireland part 1, and in the end I'll say, do it. Best of luck. Thank you.